Hi everyone. In the spirit of National Cancer Survivors Day, I'm going to have a sit down with my wife and ask her a few questions on her journey with this disease. So first, tell us about yourself.
Hello everyone, my name is Arnita Brown. I am a 42-year-old woman living here in Southfield, Michigan. I currently work for Chrysler Automotive and I am living with metastatic breast cancer.
Does cancer run in your family?
On my mom's side, I don't know of anyone who has suffered from this disease. However, on my father's side, I did have an uncle that passed away from some sort of cancer, and I had an aunt that battled with breast cancer as well, and about 20 years ago. So now she's living, she's well, and she's doing great.
Okay, and what type of cancer were you diagnosed with?
In 2017, I was diagnosed with invasive ductal carcinoma.
What age were you when you were diagnosed?
Unfortunately, I was diagnosed with cancer at the age of 38.
Okay, with your type of cancer, what are some signs and symptoms to look for?
Well, first I would like to say it's very important for women to know their breasts, know what they look like, know what they feel like. If you feel any type of lump or bump, it's important that you contact your physician. If you see that your breast has sunken in any areas or you have any type of leakage, it's important that you talk to your doctor.
What type of treatment have you received?
In 2017, first I had a double mastectomy where both my breasts were removed. After my breasts were removed, I had 6 rounds of chemotherapy, and after the chemotherapy, I had 30 rounds of radiation.
And how has that treatment affected you?
Well, it kind of affected my body in many ways. I suffered from headaches, I suffered from body aches, I suffered from nausea, I suffered from stomach aches. My appetite went up and down, and it was almost impossible for me to eat off of metal. So I had to eat off of plastic because the metal gave me such a nasty taste in my mouth.
What medical facility did you decide to go to for your treatment and why?
Well, I decided to stay with Henry Ford because that's the hospital that I grew up on, and that's like the only facility that I ever visited. So I felt that it was important for me to stay within that system, and if they needed to transfer me out somewhere or refer me to someone, I believe that they would do that.
Okay. What words of strength or wisdom would you like to share with anyone else who's going through a similar diagnosis now?
For someone who's going through a diagnosis like this, I will first have to say to stay positive. You must remain positive and know that this is not an overnight fix. There's no overnight fix for this. It's going to take some patience as well. So positive and patience.
Do you have any advice that you would like to share with people who want to support a loved one who's going through a cancer diagnosis or treatment?
I really like what you always say to me. You always say that I can't tell you that I understand because I do not understand. So I think that's a great thing for someone who's going to be a caregiver of someone with any type of disease that you have not battled, because you really don't understand. And you also have to be patient with someone who's fighting breast cancer or any type of disease, because your body go through so much and you really don't know and you don't understand what they're going through. So you have to be patient and just work with the person that you're taking care of.
Okay, and finally, why did you decide to make this video?
Well, I decided to make this video because I think it's very important for different individuals to share their story, to share what happened to them, to share their diagnosis, to share all the information that was shared so that they can know and understand that it's different ages, different ethnicities that fights this disease, and it's different things that your body can go through. And we all in this fight together.
All right, well, thank you very much. Everybody, have a good one.